within health. We've seen a lot of integration between AI and genomics, and this is what we want. We want different fields to come together, different hospitals, different entities, different countries to come together to have a much better future in healthcare.
Welcome to the Health Beats podcast, brought to you by the inaugural Abu Dhabi Global Healthcare Week. The Health Beats podcast series is your window into healthcare industry news making headlines and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We're giving you an insight into the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Larissa Trakin, and in this week's episode, entitled Innovation Without Borders, I'm joined by Dr. Mohamed Alameri, Section Head for Studies and Special Projects at the Department of Health, Abu Dhabi. We're going to be talking about Abu Dhabi's role as a beacon of innovation driven by the power of international collaboration, especially in the pursuit and facilitation of genetic discovery. Dr. Mohamed, welcome to the podcast.
Hello. Thank you. Thank you very much for having me.
So much to talk about. I want to start with your story. You have had a passion for genomics for many years. You've been teaching, you've been a laboratory technologist, and now you're back in the UAE doing what you do. Tell us a bit about that and what you do now at the Department of Health, Abu Dhabi.
Perfect. My passion in genomics started in high school. From there, I decided to go do my bachelor's in Canada and Western Ontario, University of Western Ontario, in genetics, and that's what I did. Once I finished, I went back to. I came back here to Abu Dhabi, and worked as a medical lab technologist at Sheikh Khalifa Medical Hospital, which opened my eyes to a lot of the technologies that have been used in hospital, and I've noticed that there's so many things that I still don't know. When I finished my bachelor's, I thought that I knew everything about genetics, and when I started working, it's like I'm just scratching the surface. So from there, I decided to do my master's, but I wanted to kind of change because most of my work was in diagnostics. So I wanted to change a bit. I wanted to go more into gene therapy, which was just something fairly new at that time. So I did my master's in cell and gene therapy at University College London in London, UK. And right after that, I started my PhD, and I did my PhD in epigenomics of minimal residual disease in acute myeloid leukemia. So, and because I did epigenetics, which is a niche, kind of a niche field, as a sub field of genomics, I was asked to teach methylation or epigenetics, and as part of the master's in cell and gene therapy and personalized medicine as well, and that's what I did. So I really enjoyed teaching at UCL. I've done that for around 3 years, which was so much fun, to be honest, interacting with students that sometimes know much more than me as a teacher. So this was really fascinating. And then after that, once I finished, I came back, and I joined the Department of Health, Abu Dhabi, as the section head of studies and special projects, and I'm currently leading the genome project here at Abu Dhabi, where we try to integrate the genome project within our healthcare system, basically here in Abu Dhabi.
Tell us about the Emirati Genome Project. You're already sounds like putting it to use, but give us the background. How did it start? What is the goal?
So the Emirati Genome Project started in 2019, and then the Emirati Genome Council was initiated in 2021, and it's chaired by His Highness Sheikh Khalid bin Mohammed bin Zayed Al Nahyan. And the Genome Project on itself, the aim is to sequence 1 million Emirati. That's the initial aim. But that's not the only aim that we're looking for. It's not that we sequence and keep it as a database. That's not what we want to do. We want to find out what kind of predisposition that the Emirati population have in terms of different diseases. Let's say cancer, for instance, cardiovascular diseases. These things that you can predict in a very good, let's say, manner before it happens. And so using the Emirati genome, we're trying to look at it from a population kind of view, that's the Emirati Genome Council, but individually, we're also using it to look at the genome of an individual and telling them, as part of that screening, let's say, telling them that they might have a predisposition of a certain disease. Or we can use it as a diagnostics model where we can look for, let's say, a more comprehensive diagnostic panel we can have. But well, traditionally we have like one gene that we look for, but now with the Emirati Genome Project, we have the ability to look at hundreds of genes in an instant, and then can give the results back to the patients. And from there, we can give them the best treatment that they need, a personalized treatment that they need, rather than one size fit all medication.
At this stage of the science and the clinical practice, how much can that transform the treatment of specific disease areas, having that genomic database and the person's individual profile?
The easiest example that I can give is we have an oncology flagship with the collaboration with Cleveland Clinic Abu Dhabi. We have a panel of 47 genes. Depending on the gene that we find in a patient, we give them different treatment. So it's not that it's one treatment for all patients. It's depending on the gene that we see, we give that treatment. So we've been
Because
doing
they would
that.
respond better, presumably, because
Yes,
now you have the science to know they'll respond
exactly,
better. Okay.
exactly. Oh, or they would respond. That's the
At all.
issue. They
Yeah.
just respond. With other medications, they would not respond at all. So and that's the power of genomics in this sense, per se.
Can change the outcome significantly, no doubt.
Exactly.
And how does epigenetics factor in yet, or is it too early in the science?
Epigenetics is part of what we call multi-omics. So we do have that in the pipeline, but not at the moment. But we are aiming for it. So epigenetics, at the moment, we do have some treatments, that we call them demethylation drugs, but we do have, or hypomethylation drugs, but at the moment we don't really have them on a genome kind of diagnostics or treatment. So we are planning on multi-omics, so the whole epigenomics, transcriptomics, proteomics, as part of diagnostics and treatments, but not at the moment. They're very kind of niche to be used in for clinical purposes.
One of my colleagues referred to the UAE now as a genomics oasis. Pun, I think, intended, in the sense that this is a small but powerful environment where you can come in and see some of the state of the art at work. Is the goal here to become a world leader? Is it to push? I can see, of course, how we were talking before the podcast, how this is kind of like a different flavor of community health. You're talking about serving a distinct population, one that has not always been well served. And so really getting in there and creating the best possible outcomes. You know, if you look 100 years ago, where healthcare was and where you're taking it now for this population, it's a game changer, right?
Exactly.
Globally, but we don't see it at work everywhere. We're seeing it at work here, right? So you're going to the state of the art for this in this environment. Is the goal to be a world leader?
Definitely. You need to aim as high as you can. And when you were saying oasis, a genome oasis, well, traditionally, oasis is the place that you go to get nourished. That's the place that you want to live, the place that you want to be at. And this is what Abu Dhabi aims to be. We want to be that hub for genomics globally. Not only the Emirati genome, the Arab genome has been underrepresented, well, Asian as well, has been underrepresented in global genome reference genomes around the globe. This is one of the reasons that we want to look at our genome specifically. And not only that, we want to develop drugs that are specific to our, I'm not going to say Emirati genome, but the Arab genome, because we've seen a lot of many drugs that work amazingly on the Western population. But once we put it in use here, it doesn't work for everyone. So we want to have that kind of power as well, and we want to also attract collaborations. And this is the main goal of the Abu Dhabi Genome Oasis, is that we want to foster collaborations. We want to bring in any startups that they think that they can make it in our market. Anything that will have our genomics, will welcome them here in Abu Dhabi. That's the main goal. And we're happy to share our data as well with them, the multi-genome data, which is just very unique, that has not been sequenced with this, let's say, this much. So 500,000 genomes, that's not something that we see every day. So we are ready to be that hub.
I find it really
inshallah.
inspiring. I find it very inspiring. And especially, for people like me who are Middle Eastern American, it applies just as much, the same genome. And as I was mentioning earlier, when you don't have an R&D hub in a certain region, you don't have the R&D and they don't have the representation. So it's a really, really powerful way for this population to move into the next era of digital health and more sophisticated health outcomes. I was going to ask you where you're going next, and you touched upon it a little bit, but I sort of want to go backwards and then forwards again. You've had a journey that starts in the UAE, that brings in education from around the world. You have collaborators from around the world. What's your vision of how global collaboration can work in this sphere, in the projects and the spaces that you have inhabited so thoroughly?
We can see it from a clinical part, where we want to collaborate with different hospitals, and we are collaborating with different hospitals in not only diagnosis, so diagnostic novel genes, and there's also the education. So we are already working with Harvard, in collaboration with Harvard and Khalifa University, to upskill our physicians to understand genomics, not only understand but interpret genomic data. So we have 100 physicians that are already enrolled in this program. So we are working on different hospitals clinically, and we have also the research arm, where we work with different universities here in the UAE and abroad, where we are touching upon our genome and looking on how can we identify novel genes that we haven't seen in other databases. And this is something that we're doing at the moment. And we are finding novel genes, millions of novel genes that we haven't, variants that we haven't seen in any other database. And also there's the technology, there's the biotech aspect to it, which is the main hub of which is the main, let's say, the core of the Abu Dhabi Genome Oasis. Biotechs, and bringing biotechs here, bringing second labs here, where let's say the Indian lab is in the States. We'd have a different lab here, a smaller lab here at the beginning, and then from there they become big pharma as well. So we are in collaborations with different entities from different, let's say, markets as well. Yeah.
Let's talk about genome literacy. Population wide, the end user, but you're talking about physicians, dozens of them at a time getting upskilled. That's a huge leap forward. How do you create genome literacy, and what do you think it achieves when more people are genome literate? What's at stake?
This is a project very close to my heart. I really want that's my dream, that everyone everyone knows more about genomics and how to interpret genomic data without being, let's say, a genome expert. And we started with physicians and allied health. We have many programs of upskilling. We have self study material for physicians and allied health. We have courses. So we have UAE University have a course for premarital screening, genetic screening, interpretation. We have the Harvard KU that I mentioned, and also we're trying now to make the population know more about genomics, and we're starting with a survey But we did go to different universities to tell them more about the Emirati genome and how to interpret and or how to start, let's say, a genetic program in the society. And now we're aiming for something it's called MEALIS, which is like community centers within Abu Dhabi, where we go and talk to the public about genomics and try to simplify it. But it's not about us going, let's say, I'm not going to say it's not like us simplifying genome to them. It's more like we want to take them up to us. So we want to have them basically ready to see when we send them their genomes map. Let's say we want them to understand what we're talking about without the need of going to a physician or a scientist that can translate it to them. And this is the main goal, because we've seen genomics integrate with our lifestyle enormously around the globe, and this is what's going to happen in the UAE eventually. So I'd rather, let's say, my mom or my brother or my sister know about it, have a better lifestyle without coming to me and asking me questions about genomics.
You're going to get a lot of phone calls the more the more time goes on and people can use their genome. You're going to be in demand. The not just in the UAE but globally. Do you find that some people are scared to know more about their genome? That they are nervous about their predispositions and they'd almost rather not know? And how do you talk to that sort of a psychology when it comes up?
Well, everyone has the right to know what they want to know. So I always say this is that if you don't want to know something, just tell me that you don't want to know it. It's we Genomics is not about adding anxiety, let's say, to the patients or to participants. It's about giving them a better chance of, let's say, survival in case, let's say, of cancer. But in some let's say, genetic predisposition, some people just don't want to know, and that's fair. That's fair. We can. But what I can do is I can educate them to tell them about what, if they want to know in the future, how they can know it. It's not about me telling them something that they don't want to know per se.
There seems to be a generational aspect to this for many reasons. Maybe genomics is so associated with tech and our younger generations are more comfortable, or it's come around, it's part of your education. Your degree program might not have even existed 15 years ago. But what are you seeing in the next generation, especially in the Arab world, especially in the UAE? What excites the next generation about genomics? Are they less scared, you think, than their parents' generation? Ready to embrace? Curious? What's the conversation?
I think they're less scared but more curious. I think it's because they're more curious, they're less scared. They tend to ask a lot of questions. I get a lot of questions on social media regarding genomics, regarding the Emirati Genome Project as well. So I can see that they're really curious. They want to know more about the genome, and we can see that much more, many more now students go into genomics than when I decided to study genomics, and we were only like, I remember there were like five that studied genomics back in 2008, but now there are hundreds that are studying genomics. So I think there is that curiosity, there is that let's say, wanting to know more about genomics, and not only genomics, it's like, because the field is really expanding. So there's biochemistry to it. There's like clinical genetics as part of like medicine. It's part of like clinical. It's part of the MD pipeline. So we can see that there's more interest, and that's a really good thing, since here in the UAE, not only the UAE but the whole region, because of the whole consanguinity, the high consanguinity that we have, we see more rare diseases than other countries. And that education, that when people know more about genomics, I think, well, they will get to have better decisions when they get married and have children. So this way will decrease the chances of having rare diseases here.
This is very interesting also because of the very unique opportunity you would have to make headway against the treatment and management of rare diseases that then applies and helps a lot of people around the world. It may be a rare disease, but at a global level, a lot of people would benefit from those breakthroughs. It's very, very interesting. I mean, I take this Oasis idea very seriously because the opportunity for breakthroughs and focused research is very real and very, when you apply to that, very cutting edge partnerships and technologies, some things are possible that were never possible before.
Exactly.
I'm going to take the risk of sounding too lyrical, but this intergenerational thing is really interesting. I live in the UAE. I had children learn the history, and so when you think of the ancestors, who were pearl divers to provide for their families, all the way through to this generation setting a vision, in 2019 to do this, to your generation actually having the lab experience, to the next generation taking it to places we're never going to be able to imagine sitting here in April 2024. So this really seems like a passing the torch from one to another. So I really would like to ask you from an intergenerational standpoint, being part of this collective effort to build a better life and for others to be part of it internationally, what's the collective dream? What's the dream for what this can achieve?
This is a very difficult question. It's because the dream is to have a healthy population, healthy world, and then this is what we want to achieve in the end. And we do all of this because everybody wants to live to, let's say, 200, not only live to 200 but live healthy to 200, let's say. And that's the biggest fear, is that you see people that live longer, let's say to 105, but by the time they're 90 or 80, they have high cholesterol levels or high let's say that we see different types of cancers. But with this, we can live longer, live healthier longer as well. So it's not about living longer. And my dream, to be honest, is that we don't really need to go to the hospital for diagnosis. Let's say we can know about it beforehand, get treated beforehand, and not having to go to any hospital or clinic every, let's say, 6 months for testing. And then that's the main goal of genomics. And there's a whole there's so many programs that are working on building genomes. So synthetic biology, it's building genomes from scratch. That's something very fascinating. This is very futuristic. People take it for granted, but this is very futuristic. And so hopefully in the near future, we'll be able to see more of synthetic biology that we can use.
It sounds completely different from healthcare as we know it today.
Exactly. 100% different.
We've been asking a question to all of our podcast guests that I'd love to get your take on. What do you think is the biggest challenge facing the future of healthcare?
I think security, confidentiality, that's going to be the biggest issue, because with more samples that people give, with more let's say, with having the whole genome sequenced and not put in a very secure platform, then you risk that other people can have access to your genome. And this is something that scares me, to be honest. But what I can assure is that, let's say, for the Emirati Genome Project, it's very, very, very secured, highly secured. And I'm sure other countries' genomes are highly secured as well. So this is the only thing that I would fear. But other than that, I think it will make our lives much, much, much better.
I'm personally really excited. And I'm very excited to be watching, to be sort of witnessing this. You have in the UAE, in Abu Dhabi, a very strong drive for quality of care, preventive care. And as we're hearing in most of these podcast interviews, that's driving technology to really cutting edge applications. So just on a sort of closing thought, what do you want people who come to Abu Dhabi Global Healthcare Week or listen to this podcast or watch what's happening, what do you want them to take away from that? What are the lessons learned so far that you want people to walk away with?
Collaborations. I know I keep saying it again and again. I think with collaboration, we kind of accelerate what we can do collectively. It's we're not wasting any efforts. If we work together, I think we can get much faster. We can accelerate research, innovation, healthcare. So this is, I think, this is why, and I'm not talking about like only universities or hospital. I'm talking about different fields as well. So AI, we've seen a lot of integration between AI and genomics, and this is what we want. We want different fields to come together, different hospitals, different entities, different countries to come together to have a much better future in healthcare.
Dr. Mohamed, thank you so much for joining us.
Thank you very much for having me.
Thanks for listening to this episode of the Health Beats podcast. For more healthcare industry news, visit the Abu Dhabi Global Healthcare Week newsletter. You can find the link in our bio. And if you're interested in talking more to me or to our guests, you can join us at Abu Dhabi Global Healthcare Week, taking place May 13th to 15th at ADNEC in Abu Dhabi in the United Arab Emirates. Thanks for listening. Like, subscribe, and continue to follow Health Beats by Abu Dhabi Global Healthcare Week for your global healthcare industry digest.